Good evening, my fellow South Africans. I'd like to just take this opportunity just to apologise that I haven't done a podcast for a couple of days. Reason being is I ended up back in hospital on Father's Day. I had another episode. I'm a stroke patient and all the rest of it with neuropathy and diabetes and heart attacks and whatnot all. I just want to say one thing. I just wish that one of the opposition parties will just pick up the slack here. Our government hospitals need to be seriously looked into, deeply looked into. The way I was treated at this hospital, at this RK Khan Hospital in Chatsworth, was a disgrace. I've got nothing else to say. I'm very thankful that I didn't die. I managed to come home. And we won't talk about when they took my catheter out. No warning. The nurse just grabbed it and yanked it out. I was in so much pain. I told her, I think my nana will never be the same again. I think I was screaming like a little girl there, like a little bitch inside there with the pain. My arm, my wife had to clean up my arm, and the way they took the thing out, I was discharged from the hospital with no paperwork, no medication. I still got this on. How the hell do you walk out of a hospital like this? You're not walking, by the way. My wife had to put me in a wheelchair with no assistance.
There's no porters.
There was no porters to assist, no nurses, no doctors, nobody there to assist her to get me into a wheelchair. I wish I'd taken the driver from the Uber's name, then he would have told me he had to help to get me into his taxis to get me home from the hospital. Okay, we're not blaming that. We don't expect the government to do all that for us, but we do expect a little bit of empathy and a bit of compassion when they're doing their job. I mean, I had no blanket. When I got to the hospital, when you have a seizure and that you don't know what you're doing, you're out of your mind. I can't remember. All I know is that I woke up in the middle of this, whatever time it was, freezing my butt off, calling for a thing, told to shut up because I was calling for a blanket or something warm just to make me warm.
Yeah.
I was freezing. I was ice cold. And I was told I must bring my own blanket. I remember them telling me I must bring my own blanket, but I did take my own blanket, but unfortunately I wet it.
Yeah.
And so my wife had taken it home when after she left me at the hospital. The following morning, all I remember is getting woken up, giving myself a cup of tea and a piece of bread. I am a diabetic, so I know I'm not supposed to just eat bread like that. But anyway, that's not the issue. I mean, food is food. I'm not complaining. And that was the only meal I had while I was there. I think I went in sometime during the course of the afternoon of Father's Day. My wife got a phone call earlier. She said about 8 o'clock the next morning.
Yes.
Which was Monday morning, the public holiday, to come and fetch me. That's what she told me now that I'm at home, what happened. She was there. She witnessed them taking the catheter out.
Yeah.
And he's moaning and groaning and crying like a baby. But anyway.
No, because she was rather rough. The nurse didn't care. The way she took the catheter out and the way she took your drip out was very, very inhumane.
It was very painful.
There was no compassion whatsoever. You don't treat people like that. You just don't treat people like that. You don't treat sick people like that.
Anyway, I'm nearly 66 years old, Doc. And being like that, I can't even defend myself. I mean, this arm doesn't really work. It's got movement, but it doesn't work. Between the stroke and the neuropathy, I've got this arm's the only hand that I've got. This one doesn't really do anything. It's just a spare part they're lying around. It's like rubber.
Yeah.
Or that's a painful piece of rubber from the neuropathy. I don't want to complain too much because I am grateful for the fact that the doctors did do what they have to. But then I get told I could discharge with no medication, no paperwork.
No discharge form.
No discharge form. When I must go back, they just said I must go to OPD, whatever, to get my results from the tests or whatever. I said, I don't know. I can't even remember all of this nonsense.
They didn't give you a date.
No dates.
When I asked, I was ignored. When I asked about when do I go back for my husband's results, and I was totally ignored about that one. Yeah.
We are going to start taking in spy cameras into these hospitals, and we're going to nail them. And the people with the same surnames must get the same treatment, whatever those people, because they brought those things onto the planet. Same like apartheid works from the past. Those people that gave birth to those people, whoever they works at the hospital, they must pay the price. They must remember the next time a doctor goes and he takes his motor car in for a service and he goes speeding down the road and he hits his brake and his motor car doesn't stop and it smacks into a wall or to another vehicle and his whole family gets wiped out. That motor mechanic must just say, sorry, sorry, made a mistake, didn't do your brakes properly. Yeah, think about it, doctors and nurses out there. You think you're gods. You're not gods. You're nothing. You get paid to do a job.
Yes.
You're supposed to do your job and you're supposed to do it properly. If you can't do your job and you don't like your profession, fuck off. Go find another profession. Go get another job. Become whatever you want to do. Be a rocket scientist, prime minister, whatever you want to do. But if you're not happy with your job, rather just piss off. You do get paid to do that job. You're not doing it for mahala. You're not doing anybody any favors by being there. You're getting paid to provide a service.
Yeah.
If you don't like a job, fuck off and go find another job there.
And as for the security,
that's what I've got to say to you. I go back there and that nurse had pulled that thing out of me. She knows what's going to come out of her, pal. When I put my hand where that pipe was up me, I put my hand up where that pipe was up to me, and I pull something out of her, and she can feel what it feels like.
It can happen to them too. Yeah. Wait when these things happen to them too, and they get sick. Wait until it happens to them, and they walk a few minutes in a sick person's shoes. Wait when that happens to them. God sees everything. You can't go around treating people like that. The sick, the elderly, whether you're young and you're sick, you can't go around treating the people like that. That is just not on. And I think that the health inspectors and those people from the health departments.
Yeah, but the managers of the hospital are supposed to be taking these people and monitoring them.
And they're not.
Supposed to be monitored.
They're not.
When you do your job, you get monitored.
Because
they're not getting monitored.
Because if management,
they're running a riot there.
Because if management did their job, and they went around there to make sure that everything's okay, then maybe things will be a bit better, and the hospitals will be in much better order. I mean, already in RK Cons, they've gone and locked up a couple of wards that are lying empty and full of beds. But when I asked why are those wards closed, they said, oh, because of the monkeys. Now, I recall when I was in hospital at the same hospital, RK Cons, and I was admitted there for an operation, the monkeys used to come in there and sit on the bedposts, pee all over the patients, steal their food, and run amok in these wards where there are sick people. And this is why they say that they have now locked up the wards. Now, come on, there are such a thing as that stuff that you buy, like a chicken
That's mesh.
Mesh.
It's mesh on the windows that the monkeys can't get through.
Like mesh that I've got on my windows to prevent the monkeys from coming in and making a mess of my kitchen. That doesn't cost an arm and a leg to go around into the wards and putting mesh on the windows. But no, they closed and locked up the wards. When there's patients that need to be looked after and need a bed, they go and they lock up the wards because the excuse is the monkeys. No, that's one lame excuse. Easy, put mesh on those windows so the monkeys can't get in and harass the patients. I mean, come on, that's one lame excuse about locking up wards. Now, that's why there's also not enough space in these hospitals for sick patients that get left in the corner to die. I've seen it with my own eyes. It's disgusting. As far as I'm concerned, the security there too are very arrogant, very, very rude. Hey, Sheldon? It's terrible. It's disgusting. There's no control, and that has got to come to a stop. That's really got to come to a stop.
The bottom of the line is it's mismanagement, and what we need is somebody in the right position,
It's
whoever's the
sad.
minister of health and all that, they need to start taking serious account and to checking up on the people that are working there. These people don't deserve these jobs. If they're not happy, they must fuck off. They must pack their impashla and move. If you don't want to work here, that's fine, go. But don't take it out on the patients. Without the patients, they haven't got a job.
Exactly.
They realize that. I never worked for nothing. I've worked my whole life. I haven't got a medical aid now, so I rely on the government services. But I paid my taxes my whole life, and I paid a lot of taxes. Now I'm just getting a little bit back for what I put into the infrastructure, which the ANC has destroyed, and still continuing on that path. No, this is bullshit. This has got to come to an end.
And the
We need the
filth.
opposition to step in and take these managers, the hospital managers, and they must be held accountable for what's going on in their hospitals. They need to look after their patients. It's important. Very, 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 very important. I promise you, there's more and more of this is going to start coming out. I'm not going to let this lie down. Never, ever,
It's actually
ever,
getting
ever,
worse.
ever.
It's getting worse.
We're going to start naming and shaming. Naming and shaming. Those people must be tarred and feathered like they used to do in the old days. You all know about tarring and feather. If not, look in your history books, go look on Google, go and see that's what those people working at the hospitals, if that's the way they want to treat their patients, they must rather just vial before they get tarred and feathered. Anyway, I think we've complained enough for today. We'll complain again tomorrow shortly, but we are definitely not going to let this one lie down. We're going to, in fact, I'm even going to get one of the paramedics and all that. I want to have a meeting with the paramedics and all that. I want to speak to these guys and
Because
find out
there
all
are
their
a few
jobs.
that are
There's some very
some
good
friends
people
of
out
ours.
there, and there's some people that are out there trying to save lives, not destroy lives.
Yeah. And
It looks like our nurses want to destroy people.
yeah.
They,
Yeah.
they must look after the people, man.
Yeah.
We've done our part for our country. Now it's the time for the country to do for us.
Mm.
We've done our bit. Please. Anyway, good night, fellow South Africans. Love you all. Keep well, except for you medical staff. You need to wake up now and start really being held accountable for your actions. Please think about this clearly. Start treating us, especially the elderly people and the youngsters out there. Look after them. An old man and an old lady and a baby are the same. We are helpless. We rely on our caregivers to look after us. We can't do it for ourselves anymore. We just cannot do it anymore. We're old and we're tired. Our bodies are now broken. Please. Good night, fellow South Africans. Love you all. Good night. Don't forget to subscribe, please. It does help my cause very much. Thank you so much. I really would appreciate it.
Thank you, guys. Thank you for listening to us tonight. And take care and have a great weekend further. Bye.